another veterinarian, like automatically, I don't know if it's empathy or if it's sympathy or what it is, but take it in and not intentionally take it personally, but you do. You wear it.
Yeah.
You experience it. So I don't know. Around COVID, at the beginning of COVID, I spent about 6 months off of social media for that reason, because it was an emotional roller coaster to read all the things and just be like hit with all of the things that we were kind of hit with. So I like pieced out, and then my kids started playing music, and I was like, I want to share this. I want to like see the other people that are posting the things about when they're going and playing places.
Yeah, that makes a lot of sense, especially like, I mean, it kind of gets really daunting when it's like you can't really have those real full conversations with people within like a profession or something. So like you like internalize it a lot more, where it's like because you can't talk about it more in the internalization of it. It's easy to get like angry or annoyed by like things that people are doing or like stupidly doing or stuff. Like I'd imagine, because I've definitely saw a lot of Facebook posts and stuff like early on, or even like in the middle of COVID, where like people were like, oh, I see this, seeing animals on the side of the road and stuff. Like a lot of people were like throwing out their pets and stuff, and like because like it got difficult and like people couldn't handle these things, and it was a pretty stressful time. Like I imagine, like
I think a lot changed.
Yeah.
In 2020.
Yeah. What was the kind of a thing that like? So how long have you been in business for?
2.5 years.
2.5 years.
So I guess June of 2022.
So was there like a time like within like the COVID or like stuff that you kind of wanted to start taking that route of going into your own establishment of veterinary medicine, or?
I guess it was before COVID.
Before COVID.
But COVID kind of like made it like to where in my mind it needed to happen, because I know it kind of did a reset on, I guess, your frame of reference of time and how much time you may have or may not have.
Mm-hmm.
And so do what you need to do now.
Yeah.
And don't wait.
No,
that was I guess the paradigm shift, the perspective shift.
Yeah.
That we don't all have the time that we think we have.
It's a heck of an eye opener, especially like kind of like I think a lot of people realize their capabilities, especially during COVID, because I mean people still had to pay bills and people still had to do certain things, so it's like people had to get very innovative on the things that they ended up doing and providing for their skills, but also for their households and stuff. And like,
well, veterinary medicine, I guess we were deemed, I guess what was the term, essential workers. Yeah. And so, but we went strictly to emergency work, like urgencies and routine things like went on the back burner.
Yeah.
But then everybody had all kinds of time at home and started adopting dogs, started getting dogs. They're like, they don't know how long they're going to be home. And so hundreds of people, adopted pets, and then wound up, I guess, flooding the veterinary market with that need. So even like pre-2020, there was still a need and a demand for veterinarians, but after 2020, like it exploded.
Yeah. It's like, it's kind of like what kind of pops in my mind with that is like people started learning more about their pets, or like learning more in general.
I think people started learning, or being at home and then working from home. People, I guess, went with the notion that they have time for pets now.
Yeah.
Whereas before they may have perceived that they didn't have time for pets.
Cool. That makes a lot of sense. I mean, it's crazy how much you can see when you like are around it, and you start to pay attention. Yeah. Cool. Well, hey, what's up, everybody? My name is Sergio. I'm with Offbeat inside of Quasi Studios, brought to you by All This Entertainment. And tonight we have a very special guest, Mr. Justin Mims. He is a doctor of veterinary medicine, and he is the owner-operator of Tillman's Corner Veterinary Hospital. And we've had a pleasure to be able to sit with him, talk to him about what he does, not just like what he does on a daily basis, but how he got to where he got to, what kind what really inspired you to become a veterinarian, and we're going to kind of get into that a little bit tonight. But we want to get to know Justin a little bit more, because he's not just a veterinarian. He's not just a music lover, and he does all types of things that are very, very exciting and very fun. That I think if you're looking for somebody to be a part of a group or something like that, like especially like recording, mixing music and stuff, he's got a very good knack for that. And so we're going to be getting into it. So Justin, is there anything that you would like to say to the people as we start?
I don't know. I guess I was going to answer your questions.
Okay. Well, that was a bad question to have asked, because I didn't. Yeah. It was non-open-ended.
Yeah.
So we were kind of just talking about a little bit before, just about like animals, and like we were talking about COVID and like the response for people to how they kind of saw the influx of veterinarians within like the market of 2020 and everything afterwards and stuff. So, I mean, before we get into all that, like, why pets? What kind of like stuck out to you as far as animals, or what was it, animals? Or?
I guess it was horses. And so when I started dating my girlfriend in 1995 or 96 or so, she had horses, and she drugged me out to go riding horses. I was scared to death of horses, like freaked out, like wouldn't go near them. They like would come near me, I would freeze. But she had complete control and knew exactly how to handle them. Mm. And eventually, like after a few months of like me following her around and seeing her, I kind of became horse crazy. And then I thought, well, I'll make a career out of this. I was like, I wanted to go to school, potentially go to medical school. Mm-hmm. And then I was like, I would love to be able to work outside and work around horses. I mean, I spent like every day around horses for up until I went to vet school. Yeah. And then I wasn't able to take a horse with me. Her dad still had horses, and we would go and ride, but I would ride sometimes 2 to 3 times a day, like in the morning, go to school, go to work, come ride a horse, go back to school, go back to work. And so I was the typical horse crazy teenager. It's usually females that are around horses. Yeah, but like I said, I went nuts about the horses, and that kind of became a primary obsession. And then that obsession turned into school, because it's like, I want to get there, I want to be there, I want to be able to work on horses. I want to do the things that I saw the veterinarians that came out to see her horses. I wanted to do what they did. Yeah. And so that took me down like the path of veterinary medicine.
Which is cool, because like there's a whole thing where you do what you love, you don't work a day in your life kind of thing. Mm-hmm. And it's not like, I mean, being able to be like having that inspiration of seeing people do what you're kind of being inspired by, like what do you want to do? Well, this seems to make sense, because you love doing it. Yeah.
And it did. And I worked my first year out of school, I worked exclusively on horses. Mm-hmm. And so I did an internship, and like, I don't know how many hours there are in a week, but I just did a little bit less than that per week. So, I mean, I was working like close to, 90 to 100 hours a week. Jeez. Seeing horses. I'd get up at 7 in the morning, go into work, stay there until about 7 at night, come home, like eat dinner, like sitting on the floor in front of a coffee table, wake up to my phone ringing. There's a horse coming from Atlanta that's going to be here at 1 o'clock. And then basically like be awake until I head back to the clinic. Yeah. And then it winds up having surgery. I stay there through the night, check on it through the night, hang fluids on it, and then, I guess monitor it. A lot of them had some pretty intensive care. And so I pretty much lived at the vet clinic during my internship. Jeez. I learned a lot. But I spent a lot of my time tired. I can't even smell Red Bull without it taking me immediately back to going in to do a colic surgery.
PTSD, like moments that smell.
Yeah, I bet I drank a sugar-free Red Bull the other day, and I was just like, God, I forgot about this. And so
this taste.
Yes, it's one of those things that it's an instant thing that takes you back to that mm-hmm. memory of like driving into work tired,
Oh,
like
God.
to be there through the night.
It's like, but you know, like I love moments like those because you know, kind of like looking back at where you were and to where you are now. Like, I mean,
Yeah.
thinking to yourself, thinking. I mean, I imagine like because I've had moments where I look back, I'm like, dang, I can't believe I came out of that.
Mhm.
Like, and hey, the plans worked. Like,
Yeah.
you know, like so. Was there any like moments? Did you ever have like any doubts when you were like in school? Like, I mean,
Every day.
things
So yeah, every day. Because I mean, you kind of get taken away, like not taken. I mean, you still have access to like the things that you love. Obviously, vet school, it is a full-time job. I had friends that worked. I don't know how they did it,
Mhm.
but they worked. But studying for school, going to school, you're going to school pretty much every day. But you kind of get disconnected with like why you went to school. Like the first 2 years, like you don't really like see animals or
Mhm.
touch animals other than the ones that you may have. The first 2 years is really, you're learning large animal and small animal, but it's really focused on a lot of small animal. So for somebody that wanted to do large animal, at the time, I felt really disconnected from why I was at school.
Yeah.
And so even though I was doing well in school, I wasn't doing well in school. And I thought, for a while, I was like, I don't know if I want to do this. And when you've invested that amount of time and effort into, making good grades in undergrad and, you're busting your butt to continue to make good grades, it is, can be kind of disheartening when you're not in touch with like what brought you there.
Yeah. So what was it that kind of pulled you back? Like where?
I guess finally getting to the point to where you are doing more clinical things instead of just doing like book work and lab work. You start going, and doing like learning more steps about the diagnostic process, like with an animal in front of you,
Mhm.
instead of like just reading about it in a book and, looking at slides on a microscope and learning about, parasites and what all the different tissues do when they're normal,
Yeah.
and then learning about things when they're abnormal. It's actually taking that like base of knowledge that you have, and then the other skills that you have with like handling animals, like being around horses.
Mhm.
That was something that I enjoyed, was just like, I don't know, the presence of a horse, because if you don't know how to be around them, you're dangerous.
Yeah.
They're
Yeah, that makes sense.
they're dangerous, but it's because you're dangerous, because you don't know where you're supposed to be, how you're supposed to
Mhm.
be.
You've told me that it's talked about this before, like about like how sometimes anxieties and worries and stress can
Mhm.
like rub off from the owner onto the animal,
Yeah.
and how it's like important to kind of keep your cool or keep yourself like
Mhm.
control, and like you were saying, like when you first like were introduced into horses, like they were scary at first, but seeing
Mhm.
somebody that had that control or had that ability to not freak out, to ease the situation, like I imagine like that was a lot nicer than having somebody that was freaking out. No, don't do that.
Yeah,
Don't do
yeah,
that."
because there were several little trail rides that we went on where, like, the horse I was riding wouldn't do what it was supposed to do,
Mm.
and me being like a teenage kid, thinking like I should be able to make this horse do what it's supposed to do, and then my girlfriend at the time is like, "Let me see the horse," and
Mm.
she takes the horse, rides it down the road away from the other horses that it was interested in,
Mhm.
and then I walk her horse back, and then she gets back on her horse, and I basically follow her on the horse that I was on. So that was kind of like my experience my initial experience with horses, is I had no clue. And she, like you said, she had complete control, but it wasn't because she was bigger than me. It's just that she was smarter than me at the time.
Well, hey, at the time.
Well, I
just
didn't
at
mean
the
that.
time.
But it's smart, more horse smart than me.
Horse sense.
Horse sense. She definitely had more horse sense.
That was a
than
good
me.
Disney movie.
Yeah. I don't know if I saw that one.
No, that's okay. That's okay. I've been going through Disney movies like crazy, just looking at the app, just looking at old movies that I've seen. I'm like, oh yeah, I remember that one. Watch
Yeah.
that.
I don't know if I've seen horse sense.
So like kind of going back into like the school process and everything, like
Mhm.
like how did the transition from like going from school to like find like an area that you kind of felt like, because you had said before that you wanted to work on those large animals.
Mhm.
So how did you kind of go from the process of going to school to finding an actual area to work to be able to kind of fulfill like that want?
Yeah, well, school, there's a lot of options where you can do externships and, basically like little mini internships may be for a couple of weeks. And then we did a preceptorship, which was a couple of months, but you can go into different areas, like kind of meet people, see if like this type of practice is what you want to be a part of. You do a lot of electives, and in those electives, you may, be able to travel and go, visit a clinic or pick up that experience, and then I guess kind of meet other veterinarians and kind of create a little network for yourself. And the vet school is very good about kind of putting you with veterinarians or putting you into practices to where you can have an opportunity to learn, and then kind of, take those steps into looking at the different practices that may be suited to you.
Yeah. So as far as like finding all those, what you feel suits you, I mean, how does like finding family, how does, getting to that, I mean, because it sounds like, work is starting to go well and stuff. So like, how does the other side feel, like the heart, the
I guess right out of school, it's like you're still like school. The best analogy for like the amount of stuff you're learning is you're trying to drink from a fire hose. That's what they told us. And that's what, when you get out of practice, it still feels like that. You've got so much that you're attempting to learn. You've got so much that you've learned that you're trying to put into practice now, that it's overwhelming and daunting. And when I moved to Mobile, I remember, I guess this is the family part of it, is that like the first year that Ethan was alive, like I was in an internship. Like I saw him in little windows of time. The same with Ella, like Bethany, it was the same kind of thing where I could go days without seeing the kids awake. And when I moved to Mobile, I remember that, I guess it was a year that Ethan was a 1-year-old, and Bethany's like, "Do you want to bathe him?" And I'm like, "I've never bathed him."
Yeah.
And so that's how, I guess, practice, it can consume you. And I think it took me until my kids were in high school to realize that the large animal side of things was too much for me. Like if I wanted to be a good father, a good parent, a good person, like to myself, is that, I could no longer, I guess, go that route.
Yeah.
Because I mean, it was exhausting, but I felt there was a need for me to be in that position. And so that was very hard for me to kind of step away from that. But knowing that all of a sudden I've got, a kid in elementary school and high school and going on to college, that it was kind of time to make a change.
Yeah. So how does that process kind of start? I mean, like, did you have a plan to really get into your own practice, or were you like working with other, like, from going from larger animals to smaller animals? Like, what did that transition
I
look
was
like?
I was still doing, I guess, mixed animal practice, but probably about 80 to 90% of what I did was large animal or farm animal. So I did ambulatory, and I drove, around the county of Mobile, occasionally into Baldwin County and into Mississippi. But I still had my hand in small animals, so I had, was doing surgery pretty regularly, like seeing outpatients when I didn't have like ambulatory calls. So I still had, I guess, access to that side of practice and still kind of exercising that knowledge base.
Yeah.
But, the plan was, I guess, to try to own my own practice. And I happened to have a classmate that was selling a small animal practice.
Okay.
And so I went and looked at that and started that process before COVID hit.
Yeah.
And then COVID hit, and it slowed things down, like slowed it way down.
Yeah. Dude, COVID, man, it was a killer. It's crazy.
Literally.
It was, yeah. But again, we were talking about this beforehand. It was just like, it was kind of cool how, like, you just kind of see the capabilities of what you can do. Like, you've been working on these things. You develop these skills over time, and sometimes we forget how skillful we really are as individuals, as working for somebody else or working for a company or a conglomerate, where it's like, dang, like if I can just like have some focused hours on like what I'm good at, then like developing a portfolio to go anywhere and
Mhm.
create what you want, do what you want. Like that's cool.
Yeah.
Like,
And I was definitely able to do what I like in practice,
Mhm.
what I wanted to do.
yeah.
And, but it was one of those things to where, what I wanted to do, was definitely, I loved going to, I loved all the people. I loved traveling, going to farms,
Mhm.
seeing horses, or being out in the country. I mean, that was very enjoyable. Like, just drive. I was bad about taking different routes because I could see different parts of the country and get a different perspective every time I went there. So I loved being out there, but, I knew I needed, I guess, to make a change.
Well, that don't sound bad at all.
No,
It's always nice to go that scenic route.
it was enjoyable,
Yeah.
that part of it. But I guess the downside to that is like when you are somewhere like and somebody needs you
Mhm.
and let's say that they're on one part of the county and you're up seeing an emergency somewhere else, it was really tough to like know that that person that's depending on you and the other person that's seeing you, they're depending on you to be there at a certain
Mhm.
time, and I need to be here and there. And
Yeah.
so that's the bonus of being like in a vet clinic, is that now I'm in one place.
Mhm. And now people can find you. People can know that they can feel safe when they're in need
Mhm.
for their animal to be looked after, cared for, and you have a great team too. Like I mean, like y'all have
I do.
a lot of fun people. Like y'all seem to really get along. They really seem to like feed off of you as far as like, knowing what you're wanting them to do, but also knowing like where they need to, their own job specifically,
Mhm.
where they show their own initiative to get things done because they know what needs to be done and stuff. And like y'all have a pretty cool system, like like watching y'all like write on the whiteboards and like knowing like,
Yeah.
hey, these are what we're gonna be looking at this today
Yeah.
and stuff like that's cool. Like, so like I mean, how did you? I mean, was that a process that you kind of felt like that kind of fell into place, or those processes, like, did those kind of just happen like over
It's
time?
more of trial and error.
Trying to,
And it's kind of like putting yourself in and doing something and just like messing around and finding out, is like what order of something works best. If they watch this, they're going to cringe because they're going to hear me using all of my like analogies. But, it's kind of like setting up a surgery day is kind of like setting up for Thanksgiving, like for a Thanksgiving meal. Like
Oh, no.
you don't go and start cooking like the rolls first.
yeah.
You don't go and like start with the things that are going to take the least amount of time. They may be like the quickest thing. You have to start the turkey first.
Mhm.
And so that's kind of the same kind of thing, is that there's a lot of different little processes to where it's like we do intake, on the surgery, because you've been there on a big surgery day. You've seen how chaotic it can get, but just going through the process of bringing, things in, figuring out what we need to do, and then, starting to medicate animals, getting everything kind of ready, making sure that we have all the surgery packs we need,
Yeah.
looking at the number of surgeries that we have, and then like trying to figure out, okay, like we've got 10 spay packs. We have 12 spays to do today. So we know we need to start turning things around, but like getting people thinking in those kind of processes of like what needs to be done is kind of like, it's the same kind of thing about knowing what needs to be in the oven,
Mhm.
like which casserole needs to be cooked first,
Yeah, which
where's
one
the
has more
turkey?
time and
Yeah.
like yeah.
And so it's the same kind of thing. And it's like I guess I'm not a chef, but more like, I guess, a short order cook, trying to like orchestrate everything. Or I may be the person that just shows up and eats, and everybody else is who gets everything.
I love
in
that
place.
you're using a food analogy while we're talking about
Food.
animals.
Yeah.
And we were
Yeah.
talking about Chinese food earlier, and now I really want Chinese food.
Yeah.
And just because that circulate chicken, that really good chicken.
It's
Yeah,
good chicken.
So as far as like the processes of like getting to like where people come in, they know kind of the process that they're going to be doing. Did you like do that with every single person, or did like you kind of start with like having one person kind of understand how you wanted to do it, and then they kind of showed other people, or was it like a process that you keep kind of like bringing back? Okay, guys, we're going to do this, this, and this, and like.
Well, it's kind of constantly being revised, and
Okay.
I think it really kind of throws everybody off because I changed the way I do things, because I'm like, all right, that's 2 steps over here, and I don't want to take those 2 steps. And then I'm like, I'm staying on this side of the surgery table now, and I'm not switching like the sides. I think that kind of like messes with them when I change things up. But it's been so long, like the majority of the people that I work with, I've worked with for, some, over a decade, and then, 6, to 9 years. And so I feel like, I don't know, at this point, I think they're training me now. It's kind of hard to remember the inception, I guess, because we are, years down the road, and everybody knows their place, and they do things that they anticipate that I'm going to do. And so sometimes I come to ask the question, and it's like, it's already done. And
that's going to be a good feeling, though.
Yeah, it is. Yeah. And so, but knowing, we do have like, essentially, a lead, technician that's, been, I've worked with her for almost 12 years. She kind of sets things up and helps people learn, kind of mirrors, I guess, the way that I do things. And then you have people that do things differently. And, that's the thing that I kind of enjoy, seeing how other doctors work, seeing how other clinics work, seeing how other like technicians, work with their doctors. That's good, because before I bought this clinic, I was doing relief work, and that was it wasn't challenging. It was different to be cooking in someone else's kitchen.
Yeah.
So back to food.
You're making me hungry.
but it was different, and everybody trusts differently. And so, when you are working with new people, they need to figure you out. You need to figure them out. And so that was kind of challenging, going and working with new staff.
Yeah.
But I did that for, I guess, about a year and a half, while I was in the process of buying the clinic.
Yeah. I mean, that's a good way to like kind of figure out how to understand different personalities by working with different people as frequently.
Yeah. And you learn, you do learn a lot of things that you not necessarily, you may not want to do in your practice, not good or bad, definitely processes. Not saying yes, but different processes. And you look at it and you're like, what could I take from this and put into my practice? Like how could I make my practice better with what I've learned from here? And that was, that's kind of how I've approached, I guess, how I manage, the people, and then how I guess manage my time, and how, I try to encourage those people to help manage, our time. Yeah. Because it is something to where without all of the people in place that you have, like from a receptionist to, to kennel help, to assistants, to licensed veterinary technicians, to an office manager, there's so many different moving parts to a vet clinic that it can be overwhelming. So you have to, like, if I'm trying to do all that, then I'm going to do everything bad. And so having other people, doing things, allows me to hopefully, focus on being a better doctor, a better surgeon, a better diagnostician, instead of worrying about all of the moving parts of the practice. Yeah. I know I've got people that are looking, that trust me, and I trust them, and they understand what I want and how I want things. I understand how they want things. And so I try to stay out of their way, because I think that's primarily how they want things.
Hey, well, like it's good to know, like, that I'm sure there's a lot of people that really enjoy that environment where they feel like they're free to learn and not be like, oh, you can't do that, but like, be told to do something else. Like, you see, there's a freedom within that. Like, I definitely see that within whenever I'm there, like, and people are just working and just doing their thing, like, and you like you said it earlier, like, you don't have to walk. You saw that you had to walk 2 steps, and you didn't want to walk those 2 steps anymore. Like, seeing like how they'll check on you and be like, what needs to be done, kind of thing, rather than like, because you didn't even say anything outside of just like doing your thing, and then you would see them walk up and they'd ask the question, then you're like, oh yeah, I need this. It's like kind of like, it's like a process like that seemed really cool to unravel, and it seemed like you could see that there was a moment where like that didn't necessarily happen, but then it got to a point where it started happening, and then you just got comfortable, which was really cool. Like that's a really cool thing to see.
Yeah.
Like,
And that's the thing. I mean, it's everybody's. I feel like a lot of the people that are everybody we have is pretty intuitive in understanding like what the next step is going to be, and so I don't know, getting them in the mindset of knowing that okay, this is if you think this needs to be done, then go ahead and do that. That's a big kind of discussion we're having right now. Is like, just don't be affected by what's going on here. Like you're here to affect what's going on, not just be drug around the clinic. You know,
it's like you know what you want to do, you
everything.
know what needs to be done.
Yeah.
Let's go ahead and do it.
Yeah.
No, I feel that. Yeah, I feel that definitely. Well, hey everybody, thank you very much for joining us for Offbeat inside of Quasi Studios, brought to you by All This Entertainment. I'm Sergio, talking to Justin Mims, Doctor of Veterinary Medicine. He is the owner and entrepreneur of Tillman's Corner Veterinary Hospital, and we've just been talking a little bit about his history and like his private practice, Tillman's Corner Veterinary Hospital, inside of Tillman's Corner. You can check them out, tillmanscornervet.com. Go to their Instagram page, Tillman's Corner Veterinary Hospital, and Facebook, and just get to know a little bit about who they are. They do so many different types of outreaches, community outreaches with animals, events, dog adoptions, spays, neuters, a lot of things with the cities that, you know, if you're looking to be able to adopt an animal, you know, there's a place to go because there are people that care to make it happen. And so we're going to be right back after these messages, but when we do come back, we're just going to talk a little bit more to Justin about what comes next, you know, what we're looking at, and just kind of see what's happening. Thank you.
Sounds good.
Cool. Yeah, I don't. Oh man, that's such a daunting thing to think about. Like,
Absolutely.
well, hey everybody, what's up? Thank you for coming back to Offbeat inside of Quasi Studios. I'm Sergio, brought to you by I'm brought to you by All This Entertainment, apparently. I really want to do like a J thing. It's like, shoot, cut it, go back, we'll do it again. But we can't. We don't need to do that because we're live technically. What's up?
Not too much.
So our special guest tonight is Justin Mims. He is a doctor of veterinary medicine at Tillman's Corner Veterinary Hospital. He is not just somebody that works there; he is the owner as well. And we have been just talking a little bit about the humble beginnings of where Justin came from large animals and then doing mixed pets into having more a clinic to where now he's not going everywhere to see everybody. Everybody can come to him more centralized, and it's a little bit easier, a little bit simpler, able to provide family, have more of a family life. Is that so kind of like going from like just like ownership and stuff, like where do you want this to be? Like we kind of were talking during the break a little bit about like oh, I want to do it, like not be working anymore one day, but like what does that look like? Like, I mean, because y'all do so many different community events, y'all do so many different ways to showcase and spotlight what y'all do, but how do you feel that can translate into like more clientele, more business and stuff?
I guess, well, I've had several people kind of acknowledge, I guess, what they see us doing. I'm not really vocal about a lot of the things we do. Like, I mean, you see the spays and neuters that we're doing because you've been there when we're having a huge day, but the general public may not know what goes on behind the doors. And so I feel like that's been acknowledged. People have seen that, and there are people like, well, because you work with rescues, are you are working and trying to spay and neuter everything that you can. They want to, I guess they kind of want to support the veterinarians that support that. Because it is difficult. Not every practice can do this, but I'm kind of mirrored a couple of other practices that I've seen. So people that I've learned a lot from, like Dr. Nisley and Jennifer Wilder. That's kind of how they started their practices. Dr. Nisley had started, I guess it was called South Alabama Spay and Neuter, which became Spring Hill Animal Clinic, and then Dr. Wilder has ARC, and they both really started kind of in that kind of field to where they were doing like a ton of spays and neuters. They were doing a lot with rescues, to where it does get you, like for me, I want to work and do things for the community. I want to be able to like make a difference. But at the same time, I do have a business that we're trying to run. We do want like people to come to us. But my I guess sole reason is to be able to, work with people, help people, help people by helping their animals, help the community by helping, animals that are in need. And then also, be able to provide for myself, my family, and then the employees and their families that work for me.
Yeah. So I mean, we were talking during the break, like just in the few short years that you've been open, the amount of growth that you've seen for yourself, and just kind of seeing how it goes. Like I mean, so I mean, with that growth and everything, are you hoping that it kind of you want it to be as consistent as it been, or you want it to be faster, or like I mean, do you have like a 5-10 year kind of goal that where you see certain levels?
Cruise control. Yeah. Like I eventually want it to be on cruise control because, like I said, I've done a lot, trying to, to be able to be accessible. Because if you're not accessible, like you're in a business and you don't have any appointments available, or you don't have, you have a finite amount of time, then you're not going to grow. You can't make more time. So like effective use of like, staff and licensed veterinary technicians has kind of, I guess, been one of the mindsets, being able to hire relief doctors for the past year, and then, eventually being able to hire another doctor, gives us room to grow and also spread, things out, because, it does get to a point to where there's too much.
Mm-hmm.
And, I felt like I was there, in the spring, and there, shortly before I hired, Dr. Newsom. So it's, growth is good, but growth that you can not keep up with, or, your head's spinning, you don't know what direction, to look. Some days it would get like that.
So do you feel that the spinning of the head is kind of less now that you have somebody to share the workload, to where now you can focus on developing some more clientele? Like, I mean,
yeah, we do, now having, a full-time doctor instead of having like two, part-time doctors, that definitely helps, I guess, create accessibility to a doctor. Because before, there were days where I would have surgery, and it's like, I'm only available for a drop-off during this time, or I'm only available, for a few appointment slots in the afternoon. So now we have, to where, we can kind of split up every day to where we should have outpatients available throughout the day. And so that kind of creates that accessibility, because when people need you, they need you. And, there are urgent things, there are emergent things, and there are, things that may arise from poor planning.
Yeah.
But you definitely want to be there for the urgencies and the emergencies. And then when you do have people that, you've known for years, or people that, have, used you for years, you want to be able to accommodate them. You want to be able to, help them get what they need to get done. So they can go on vacation, or they can board their dogs, or they can get the medication that they need in the time they need it.
Yeah. So what is it like an everyday kind of like day look like for you, for whenever, because I know you said you have surgery days, and I know there's like spay and neuter days. So, I mean, how do you get to the point where you figure out those are your specific days that you want to do those surgeries? Or
I guess it kind of started off with like, what's the slower day?
Yeah.
And so some Mondays and Fridays are like typically busy days, and then Tuesdays and Thursdays it kind of steps down a little bit, and then Wednesdays, they can, traditionally Wednesdays seem to be slower. So that kind of, I was like, well, we're going to do a big surgery day on Wednesdays, and then, do outpatients in the afternoon. And that's kind of how I started that.
Gotcha.
And then as we, again, continue to grow, then like people are like, well, you're open on Wednesdays, because we initially were closed on a half a day for Wednesday, because, there's only so many hours that you can work, and only so many things you could do. But when I first bought the clinic, we were closed half a day on Wednesdays. And so kind of filling that space, that's kind of how I started to do it. And then now we're pretty much doing surgery every day of the week, and outpatients now every day of the week, pretty much open to close.
Yeah, that's pretty good though. That's good. That's not like being able to open a little bit longer. Like, I guess, would that mean because you feel like you're like getting more clientele to have you be open longer? That
Yes.
Gotcha. That's cool. That's very nice. So then, okay. So, as far as just like, not just just a daily day-to-day thing, but what kind of services do you typically offer, like at your clinic? Because I know you talked about before how there are certain specialists and stuff for certain things that you may refer to other doctors and stuff. But like, what could people, if somebody come in, like I know they all have like some spa days. Can you kind of like elaborate on some of those?
Yeah, like there are basic, I guess that's kind of in the grooming side of things. But we do, basic grooming. A lot of what we do is like routine or preventive care, to where, animals come in, maybe getting, updated vaccines, or, getting a heartworm test, getting, yearly heartworm shots. That's preventive care is a large part of what we do. And then we do, like basic dentistry, extractions, things of that nature, dental prophies, we're cleaning teeth. Those are kind of on the surgical side of things. Treating like masses, I guess I won't drifted off into surgery, but we may do like, mass removals, surgeries on the skin where you're taking off little things or taking off something that's growing down, underneath the skin. And then
You're saying that I remember that dog that when I came in there that one day that had that big tumor on its leg.
oh yes.
Yeah,
Yeah.
that was, oh man, that was
Yeah, and
insane.
that was I think that one was a sarcoma, so it was a rather aggressive tumor.
Mhm.
But I'll have to follow up and see how that dog's doing now. But we do things like that. They got the dramatic doo-doo paws. But we do those type of surgeries to where we are taking off, kind of the crazy things, and there are more routine things. Also do some orthopedic surgeries. So for dogs that kind of fall into like a certain weight class, I'll repair cruciate ligaments depending on the type of fracture, the location of the fracture. I may do some fracture repairs if it fits kind of my skill set. But if it doesn't, then I'm referring to, Dr. Myers and Theodora. That's a common place where we refer a lot of orthopedic surgeries. And then, MedVet has a surgeon there. So surgery is a big part of what I really enjoy surgery, but also, enjoy outpatients because you are interacting with people. You are kind of going through like a diagnostic process to where you have something that comes in. Sometimes you can read the appointment notes and what you're going to be dealing with, and sometimes you read the appointment notes and you're like, we're going to be having to figure some things out. And so, but I do enjoy the diagnostic process, because it is, you're trying to take what's presented to you by the owner, what's presented to you by like an animal that can't speak. You have a person that's trying to tell you all the things it's doing, and then, you're just piecing all of these things together.
Mhm.
And sometimes, like, you go off on tangents, and then, other times it's like, you hit the nail on the head.
Mhm.
But that's a part of the diagnostic process, is ruling things out. It's difficult.
Yeah.
It's difficult to explain to when you're like, we're going to look for this, we're going to look for this. And then you come back and you're like, we didn't find either of these things. And it's like, well, now what do we do?
Yeah.
I was like, that's a good question. Yeah. And you keep going and you keep looking, turning over the rocks, looking under them to see what you can find, which I think for some people can be, for a client, that's like an exhausting experience to have an animal that you're trying to diagnose something and you can't diagnose it. I think that wears me out just as much because, I feel responsible for the test that I'm asking someone to pay for.
Yeah.
And, if those things that you're asking somebody to spend their hard-earned money on don't result in like a diagnosis, then you feel like,
Like there was a
you're-
disservice or something.
Yeah. Even though, that there's so much gray, like at school, it's black and white, it's A, B, C, or D. It's like, what is this answer? And then when you get out of school, it's kind of like, well, this dog isn't the exact same dog that was on the test.
Yeah.
This isn't what I recall. And that's the hard part. I guess the diagnostic process that doesn't immediately yield something or bring some tangible results to where you come to somebody and say, I know exactly what's wrong.
Mhm.
And sometimes you know exactly what's wrong, and the fix for it is going to be the hard part. And, other times you're like, it's going to be simple. We're going to open this abscess up and it's going to drain,
Yeah.
and your animal's going to be fine. And other times it's like a tumor in the abdomen, and it's going to be an extensive process.
It's like I guess being able to know that, like, it allows like the clients that come in to understand not just how you work with them, but see how gentle you can be with, essentially an animal that is like a child sometimes.
Mm-hmm.
Like they can
They're
feel
definitely
that.
people's children.
Yeah, yeah. And, and we actually got a chance to be able to talk to Justin a little bit at the clinic, too. He did a sit-down with us, and we asked him a couple questions about allergens and different, like, the difference between heartworms and, heartworm medication and flea and tick medication,
Yeah.
the similarities of some, but, sometimes, if you're going to do preventative, you always want to actually do specific to the disease or the allergen that's actually, the animal may have. We do a lot of different conversations he talks to us about how some best practices to, make sure fleas don't, stay outside, and like, inside ways to prevent certain things from, dogs and cats being infested with fleas in your houses and all that stuff, which one of them was, of course, vacuuming. You actually said that in one of them. Is like, I don't want to tell my clients to be like, listen, you got a dirty ass house, but hey, you need to vacuum a little bit.
always preface it when I'm like telling people, like, all right, fleas are like, they're small, like what's on the dog or what's on the cat is like, it's like the tip of the iceberg. The remainder of it's in the environment. So it could be the house, carpet, fleas like to live there, and just the vacuum cleaner kind of mimics like the vibration and like the heat, and basically stimulates the fleas to like mature to the next stage and like come on out.
In my head, that's like so fascinating to see. Like, I just see tiny little eggs just.
And then, then they but they anticipate there's going to be like a dog walking by, or there's a cat, or there's going to be a creature, and that's what they basically come out to go get them. And so vacuuming kind of helps promote that, and then promotes the removal of it. But
Gotcha.
I always preface it when I'm like, you need to vacuum 3 or 4 times a week, and I'm like, I don't think you have a dirty house. And then also treating the yard, and then treating the yard's a big part of it, because it's like, it's not something I can do. I can't go treat your yard. I can treat your dog, but I hate to use this term, but if you're just treating the dog, you're peeing in the wind.
Yeah, and it's not even prevention at that point. It's just
but you're killing what's on them. But when you have 100 on them, and you've got thousands in the yard, that need to be addressed.
Yeah, and you kind of go into a little bit of the depth of that too, with just telling us about like the maturation of how what's effective, because like heartworms and stuff, I guess you were saying that there's no teenage heartworm that can be killed with modern medicine or whatever. Like, it's like the beginning stages, the end stages.
Yeah.
And
so there's the stage we can test for, and then there's basically the stage we can kill.
Yeah.
And you can kill the adults. It's a little bit different, but heartworm prevention kills the babies, and that's kind of what we're talking about, is the middle stage. There's a teenager that's lingering or waiting to mature to an adult, because the test that we do in clinic, or even when we send it out, is testing for a product of the adult.
Yeah.
And then the heartworm prevention kills basically the baby worms. And so you've got that middle stage that's just kind of there. Yeah.
Jeez. And I very much enjoyed editing the videos, hearing a lot of the stuff that you talked about, and so you'll be able to check those out very soon on the Tillman's Corner Veterinary Hospital page, talking to not just Justin, but also a couple of his vet techs as well, learning a little bit about what they do behind the doors at Tillman's Corner Veterinary Hospital. And it's a great thing, because sometimes a lot of people may not go to a doctor or go to, better themselves, because they're not sure what to look for. And what, big goal on that is to just kind of let people know, their animals are getting taken care of, even though the dog or a cat may yelp or something like that. That's not necessarily, they're healing and helping your animal and stuff. And you told me a couple war stories about that, and clients that are really scared. And again, we talked about that, sometimes anxiety can rub off on an animal, that it can be more dangerous to have you than to not have you. But there's a lot of really great things to learn from those videos, and they'll be released very soon. But I've been here with Dr. Justin Mims. He's a doctor in veterinary medicine, and he is the owner of Tillman's Corner Veterinary Hospital, of course, in Tillman's Corner. You can check out tillmanscornervet.com. Find out what their services are, book an appointment. Again, they do spa days. They do different types of dental services. They do orthopedic services, and just check out their website. Check out what's going on. They do a lot of different spays and neuters for many animals around town, for City of Mobile, Wags and Whiskers, and it's a great way to not just give back to the community, but also allow these animals to live a little bit longer, to be able to have a more full life, because they're now adoptable. And just know that pets, as even though they're pets, they're people too sometimes. Pets are people too.
But they'll bite you.
They will bite you. They will bite
People shouldn't bite you.
Justin, I appreciate you stopping by and talking
thank
to
you,
us,
Sergio.
man. And I always enjoy talking to you.
I always have a good time.
Justin actually gave us a gift the other day, which is actually another one of these microphones, and I can't like stop looking at it. I'm gonna be glad when we get to use it. It's gonna be nice. But thank you very much for your friendship, for your business, and just being able to just talk to each other and get to know each other a little bit more. And I really enjoy like just learning, especially the processes of animals, because we do have dogs and stuff, and like it's really cool to be able to know like, hey, things to look for and all of that. Make sure that there's different medicines that the dog can have, especially with like heartworms. Of course, there's different terms of medications and stuff, and it's really nice to know that those things are available for the convenience of, But thank you very much for your time. Thank you very much for coming out here today. Again,
You're welcome.
Check out Tillman's Corner Veterinary Hospital on Instagram, tillmanscornervet.com. Again, this is Dr. Justin Mims, and man, thank you again, and
You're welcome.
We'll see y'all next time. Thank you.